Welcome to part 2 of the head injuries lecture. After we discussed the injuries of the scalp and the types of skull fractures, now we will move to traumatic brain injuries. This graph shows the major causes of traumatic brain injuries. As you can see, almost 50% of the injuries are caused by motor vehicle accidents and falls. The first type of brain injuries will be the intracranial hemorrhage. There are different types of intracranial hemorrhage depending on the site of the collection of the blood. We can classify this into extradural hematoma, subdural hematoma, subarachnoid, and intracerebral hemorrhage. This graph shows the different types and the different locations of brain hematomas. The one inside the brain substance is called the intracerebral hematoma. The one extra or epidural is between the dura and the bone. The subdural is between the dura mater and the underlying dura arachnoid. And to discuss it in more detail, we'll start with the extradural hemorrhage. It's also known as the epidural hemorrhage. Most probably it is caused by a trauma. The commonest artery to be affected by trauma is the middle meningeal artery. It runs through the temporal bone in a specific group. Also its branches, so it is very likely to be affected by head injuries. The blood is collected between the dura, especially the periosteal layer of the dura, and the inner table of the skull bone. This is a CT scan, shows the location of the extradural or epidural hematoma. The occurrence of epidural hematoma could be directly or immediately after the blow to the head, or it might take a little bit of time to develop and start to cause manifestations. The person might go into compression directly with or without lucid interval, and we will be discuss this in details in a little bit. Cerebral compression might be very severe in severe hemorrhages due to increase the cranial tension and destruction of the vital centers in the brain. And we should differentiate this from the thermal fracture associated with heat hematoma. The second type is the subdural hemorrhage, mostly also traumatic, but with inertial trauma. It is not caused by a direct blow to the head. Inertial trauma, which means that the head of the person moves with a different speed than the movement of the brain content inside. This hematoma is mainly formed from venous origin because of tearing of the bridging veins. If you remember from the first part, there is an imaginary veins coming between the scalp and the brain matter. So the cutting of these veins during injuries will lead to the subdural hematomas. Types may be acute, as in cases of shaken baby syndrome, or chronic, especially in elderly people exposed to minor trauma they forget about, and the vessels in the brain will be atherosclerotic, so it is very liable to minor trauma leading to minute bleedings, and then when it collects to form a large amount of hematoma, it causes the symptoms. Also, patients with diabetes mellitus or alcoholics. If you would like to visit this video to watch the mechanism of formation of the subdural hematoma, it will help you understand the formation of this disease. The subarachnoid hemorrhage. As you can see from its name, it is formed in the subarachnoid space. Look at this graph. You will see here, this is the skull bone, and this is the dura attached, periosteal dura attached to the skull, the inner table of the skull. It is immediately followed by the arachnoid mater. And then this is the brain and the layer of the meninges that is very attached to the brain. substance is called the pia major. The subdural space is the space between the arachnoid and the pia. And there are lots of blood vessels running into this space. Tearing of blood vessels in this space will lead to the subarachnoid hemorrhage. Most probably, this will be affected or mixed with the cerebrospinal fluid, because this is space where the spinal fluid is collected or running around the brain. This kind of hemorrhage could be pathological, associated with intracranial hemorrhage, or as a result of ruptured cerebral aneurysm. When it also could be caused by trauma associated with brain laceration, especially to the parietal, temporal, and base of the frontal skull, or trauma to the neck leading to rupture of the vertebral artery. For the sake of convenience, we summarize the difference between different types of hemorrhages related to the meninges in this table. For the extradural hematoma, as we mentioned before, it's in the extradural space, mostly in young people, and it's caused by trauma, direct blow to the temporal or the parietal bone. The middle meningeal artery is the main source, or its posterior branch. Usually, if you take a sample from the CSF, no blood will be found after a lumbar puncture. Usually, it is a progressive course and might cause brain compression in severe cases. The subdural hematoma, it is formed into the subdural space, usually in old-aged people. The origin of the blood is usually venous because of the ruptured communicating veins. It could be pathologically, it could be aggravated by the pathological atherosclerotic vessels in the old people, or diabetic people, or alcoholics. So the minor trauma causes tear of these minor vessels, leading to the development of the subdural hematomas. If you take a sample through lumbar puncture, you will not find any blood with the CSF. And the course, as I mentioned, is really progressive. So the blood will accumulate a long time. It might go into complete cure if the blood organization happen, or might develop into chronic subdural hematoma, a condition that is known as pachymeningitis hemorrhagica. The subarachnoid hemorrhage is formed in the subarachnoid space. It could happen in young, as in cases of shaken baby syndrome, young infants, or old people. The source of the blood could be arterial, as in case of ruptured aneurysm, or could be venous, as in cases of venous congestion. As I mentioned, most probably pathological with the ruptured aneurysm, or traumatic, as in cases of brain laceration or shaken baby syndrome. This is the only part when you take only type of hematoma. When you take a sample from the CSF, you will find blood cells mixed with the CSF. And the course of this hematoma will differ according to the cause of the hematoma. If the hemorrhage happens inside the brain substance, it's called intracerebral hemorrhage. Intracerebral hemorrhage could be caused by trauma or related to a pathological condition. If it happened in relation to trauma, it will happen at any age. It will affect both sexes, and most probably will be in the temporal pole or the frontal pole, the most common anatomical sites to head injuries. If the underlying cause is a pathological cause, the age range for that will be 40 to 60 years. It affects mostly males. The most common anatomical sites for intracerebral pathological hemorrhage will be the corpus striatum and the pons. The underlying pathology would be related to the hypertension, atherosclerosis, and left ventricular hypertrophy. This is the clinical picture that happens in patients suffering from stroke. Next, in brain injuries will be either localized brain injuries, as what happens in lacerations and contusions, or diffuse injury, as what happens in concussion, diffuse axonal injury, and cerebral compression. Brain contusions. Brain contusions could be known as coup contusions, which happens if the contusion occurs at the same exact site of the impact of the injury. It is known as the counter coup, or the opposite, if the injury happens to the opposite side of the impact. Both of them could happen at the same person or following the same trauma, and this is most commonly the situation. And this is of very important medico-legally, because the patient might need to consider the effect of the coup and counter coup when evaluating a patient after trauma. So the whole brain should be examined to not to miss any injuries and not just focus on the site of the impact of the injury. Another point is the defense of the assailant may claim that his defendant is not guilty if the site of the brain injury is different from the site of the trauma inflicted to the victim. So this would be explained by the counter-coup effect of brain injuries. This is a short video that explains how the counter-coup effect happens. Diffuse brain injuries, or also known as concussion. Concussion is a transient loss of consciousness due to temporary impaired cerebral functions following exposure to head trauma. The mechanism for that is acceleration, deceleration of the head. So what happens basically is the whole brain is affected by the trauma, and the different velocity between the movement by the skull and the brain substance cause the brain substance is hit multiple times inside the bony skull. The clinical picture will include transient loss of consciousness, maybe less than 30 minutes, and also the patient may develop the manifestation of shock. He might progress into post-traumatic amnesia, where the patient will lose his memory of what happened and he will not be able to remember the details of the accident. The treatment for that will include hospitalization and observation for 48 hours. A patient must be kept in the intensive care unit and his vital signs observed for at least 48 hours to guard against him going into compression without noticing the development of the compression. In this graph, I would like to summarize the different types of brain injuries. For example, at this, the patient receives a direct blow with a heavy blunt object that causes fracture in the bony skull, and also underlying damage in the brain substance. In this part, the patient fell from height, and the head hit the ground toward the occiput of the head, causing fracture. And on the opposite side, there was an injury of the brain by the counter-coup mechanism, secondary, or might happen like a secondary fracture in the brain. So the injury happened on one side, but the brain lesion also happened on the opposite side in the counter-coup mechanism. In this graph, we can see the direct impact injury causing a hematoma on one side, the acceleration deceleration injury, and how the movement of the brain inside the bony skull might lead to multiple focal lesions inside the brain substance. And lastly, the shock wave, where there is a diffuse injury of the brain and affection of the long axonal fibers in the brain substance, leading to diffuse axonal injury. So what happens to the patient after concussion? So after concussion, a patient may show complete recovery with no residual effect or he might develop incomplete recovery, a condition known as post-concussion syndrome. Or the patient might progress into compression, and this could happen directly without any lucid interval, or after a while where the patient regain conscious, a condition known as lucid interval. We will discuss this now later. Or the patient might go deaf if the concussion was very severe and there is a prolonged arrest of the vital centers in the brain, leading to respiratory failure and death.